Run your fingernail up the surface of one of your teeth, starting from the biting edge and moving up toward the gum line. Do you feel it? That distinct catch? A little notch or groove right where the tooth meets the gum? Maybe you've noticed it in the mirror, a dark, yellowing depression that looks like the tooth is being whittled away at the base. Perhaps it's sensitive to cold water or even to the bristles of your toothbrush. If you have brought this up to a dentist before, you probably heard the standard lecture, "You are brushing too hard." They told you that you are aggressively scrubbing your enamel away. They likely told you to switch to a soft bristled brush, stop scrubbing like you're cleaning grout, and maybe change your toothpaste. So, you did. You followed the rules. You bought the extra soft brush, you lightened your hand, and you were careful. But here's the frustrating part. 6 months later, the notch is deeper. The sensitivity is worse. If friction from your toothbrush caused that groove, and you removed the friction, the damage should have stopped. But it didn't. That is your first clue that something else is going on. Something much more complex than just aggressive hygiene. You are dealing with a hidden diagnosis that is missed in dental chairs every single day. It is not a cavity, and in this specific case, it is not from brushing. It is a structural failure caused by the laws of physics happening inside your mouth. Today, we are going to solve the mystery of that notch. We are going to look at why your teeth are breaking down at the gum line, why fillings in that area keep popping out, and exactly what you need to do to stop it before you lose the tooth entirely. To understand this, we first have to clear the scene of the usual suspects. In dentistry, when we see tooth wear, we typically look at 3 categories. The first is abrasion. This is the one you were warned about. This is mechanical wear. It's caused by a foreign object rubbing against the tooth repeatedly. Yes, a hard toothbrush with abrasive whitening toothpaste can cause this. But typically, abrasion leaves a wide, scooped-out pattern. It looks like a shallow saucer. The second suspect is erosion. This is chemical. It's caused by acid. Whether it's from a diet high in citrus and soda or from acid reflux and GERD, the acid dissolves the enamel matrix. This usually looks smooth, glassy, and rounded. It melts the tooth away. But then there is the third suspect, the hidden one. The one that doesn't look like a saucer and doesn't look like melted glass. It looks like a wedge. It looks like someone took an axe and chopped a V shape into the side of the tree. This is called abfraction. The reason this diagnosis is hidden is that for decades it was controversial. Many practitioners lumped it in with abrasion. But as we began to understand the biomechanics of the jaw, the truth became undeniable. Abfraction is not caused by what you are rubbing on the tooth. It is caused by the forces putting stress through the tooth. Let's get into the physics of this, because this is the aha moment that changes everything. I want you to imagine a wire coat hanger. Picture yourself holding it in 2 hands. If you want to break that hanger without using wire cutters, what do? You don't pull on the ends. You grab it and you bend it back and forth. Flex, release, flex, release. As you bend that metal, stress accumulates at the fulcrum, the point of greatest bending. Eventually, the metal gets hot, fatigues, and snaps. Your tooth is the coat hanger. Your teeth are not just distinct, static rocks sitting in bone. They are part of a dynamic, high-pressure machine. When you bite down, catch a high spot on a tooth, or grind your teeth at night, you are generating an immense amount of force. We are talking about hundreds of pounds of pressure per square inch. When that force hits a tooth at a weird angle, the tooth actually flexes. It bends. It's microscopic. You can't see it with the naked eye, but it is happening. Now think about the anatomy of a tooth. The root is anchored firmly in the jawbone. The crown, the part you see, is exposed. When you bite down unevenly, the crown pushes sideways, but the root stays put. The stress concentrates at the pivot point. That pivot point is the cervical margin right at the gum line. Here is the problem. Enamel is the hardest substance in the human body. It is essentially crystal. It is incredibly strong against compression, but it has zero flexibility. It has no tensile strength. Underneath the enamel, you have dentin, which is softer and has a little bit of give. So when the tooth flexes, the dentin bends slightly with it, but the enamel, it can't bend. So right at that stress point near the gums, the enamel rods fracture, they shatter. Tiny microscopic prisms of enamel explode off the surface of the tooth. So when you see that notch, you aren't looking at a spot where you brushed away the tooth. You are looking at a spot where the tooth shattered from the inside out because of stress. You aren't scrubbing the tooth away, you are snapping it at the neck. This changes the entire game regarding treatment. If you treat an abfraction lesion like it's a brushing problem, you will fail. So, how do you know if you have this? How do you distinguish the mystery notch from regular wear? There are 3 key signs you can look for right now. First, look at the shape. I mentioned this earlier, but it is the most telling sign. Abrasion from a toothbrush is usually rounded. It's a scoop. An abfraction lesion is sharp. It is V-shaped. If you could stick a tiny probe in there, it would catch on a sharp internal line angle. It looks like a wedge cut out of a tree trunk. Second, look at the distribution. This is a major clue. If you are an aggressive brusher, you usually brush whole sections of your mouth aggressively. You wouldn't typically destroy the gum line of just one lower premolar and leave the neighboring teeth perfectly healthy. Brush strokes are broad. Abfraction, however, is specific to the bite. It often affects a single tooth that is taking a heavy load, while the neighbors look fine. If you have one deep notch and the surrounding teeth are pristine, you can almost guarantee it's a bite issue, not a brush issue. Third, look at your history of dental work. Do you have a filling in that spot that keeps falling out? This is the most common frustration I hear. Patients get a class 5 filling, that's the dental term for a gumline filling, to patch the hole. Everything looks great. 3 months later, they are flossing and the filling pops out. They go back, the dentist puts it back in. 6 months later, it falls out again. The dentist might blame the glue or moisture control, or say, these fillings are just tricky. They aren't tricky, they are failing because of the flex. Think about the coat hanger again. If you glue a rigid piece of plastic over the spot where the metal is bending, and then you bend the metal, the glue bond is going to break. The tooth is still flexing underneath the filling. The filling is static, the tooth is moving, the bond fails, and the filling pops out. Until you stop the flex, that filling will never stay. So, if you have the wedge, the single tooth damage, or the popping fillings, we have identified the culprit. It's your occlusion, it's your bite. Now, what do we do about it? How do we save the tooth? The immediate reaction is usually, fill the hole. But based on what we just learned, you know that is the wrong first step. If we fill the hole without fixing the cause, we are just putting a band-aid on a broken bone. The solution requires a 2-step approach. Manage the force, then repair the damage. First, we have to look at the bite. We need to perform an occlusal analysis. This involves using articulating paper, that blue or red paper you bite down on, to see where the teeth are touching. We are looking for interferences. Often, we find that when you slide your jaw to the left or right, that one notched tooth is hitting harder than everything else. It's taking the brunt of the lateral force. We need to equilibrate the bite. This usually means a very minor, painless adjustment where we polish down the high spot on the enamel. We aren't removing healthy structure, we are redesigning the contact point so the forces are directed down the long axis of the tooth rather than sideways. We want compression, not leverage. If the issue is widespread, if you are a heavy grinder or clencher at night, known as bruxism, spot adjustments might not be enough. In that case, an occlusal guard or night guard is non-negotiable. A night guard is more than just a piece of plastic. It acts as a shock absorber. It locks the teeth together into a unit so that when you grind, the force is distributed across the entire arch rather than shattering a single tooth. It also separates the jaws slightly to reduce the muscle contraction force. If you have abfraction lesions, a custom night guard is often the only thing standing between you and tooth loss. Only after we have managed the forces, after we have stopped the coat hanger from bending, do we look at the hole. And even then, we have to be smart about how we fill it. Because these teeth are under high stress, we often can't use the standard, rigid composite materials we use for cavities on the biting surface. We often need to use materials that have a lower modulus of elasticity. Fancy words for more flexible. Materials like glass ionomer or specific flowable composites are often better choices here. They can flex slightly with the tooth. They act somewhat like a stress breaker. They bend rather than debonding. If the notch is small and not sensitive, sometimes the best treatment after fixing the bite is actually to leave it alone and monitor it. Once the stress is gone, the progression stops. But if it's deep, sensitive, or close to the nerve, we restore it, but only with the right material and only after the bite is balanced. However, while we fix the mechanics of your bite in the dental chair, you need to address the biology of your mouth at home. These stress lines make your teeth incredibly vulnerable to bad bacteria and biofilm, which can accelerate the damage and sensitivity. There is a fascinating new method, a strange red dental foam cleanse, that takes just 10 seconds a day. It's designed to help remineralize weakened enamel and fight the hidden bacterial threats that standard toothpaste often misses. If you want to see exactly how this red foam works to armor your teeth, pull out your phone and scan the QR code on the screen right now. It takes you to a short video that explains the science behind it. I've also pinned the link to the top of the comments below. Strengthening that enamel is the best insurance policy you can buy for your smile. Here is the bottom line. Our teeth are constantly speaking to us. Pain is a language. Sensitivity is a language. And wear patterns are a language. That notch on your tooth is a warning sign. It is a structural distress signal telling you that the system is overloaded. If you ignore it, or if you just keep patching it with fillings that fall out, the damage goes deeper. Eventually, the flexure can reach the nerve, causing the tooth to die, or the tooth can physically snap off at the gum line, leading to an extraction. Do not accept "you brushed too hard" as the final answer if the evidence doesn't fit. Go to the mirror today. Check your gum lines. If you see those sharp wedges, it's time to have a conversation about your bite, not your toothbrush. You only get one set of permanent teeth. Understanding the engineering behind them is the best way to keep them.